One of the most interesting things I've noticed as an internal medicine physician is that people spend a lot of time worrying about diseases that can kill them, but very little time paying attention to the warning signs that show up years before that happens. People worry about heart attacks, they worry about strokes, they worry about diabetes, but almost nobody worries about their liver. And I find that fascinating because the liver is often one of the first organs that tells me where someone's health is heading. When I'm reviewing patients' labs, I can often identify metabolic problems long before they receive a diagnosis, long before diabetes, long before heart disease, long before they feel sick. The clues are often sitting right there in their liver enzymes, their triglycerides, their waist circumference, their blood sugar, and even the markers of insulin resistance. The liver is quietly keeping score. The problem, though, is that it doesn't complain very loudly. If your lungs aren't working properly, you get short of breath. If your knees are wearing out, they hurt. If your brain isn't functioning well, you notice it in your memory, your concentration, or mood. Your liver can become progressively unhealthy for years without causing symptoms dramatic enough to make you seek medical attention. And that's one of the reasons fatty liver disease has become so common. Depending on the population you're looking at, roughly 1 in 3 adults may have excess fat accumulating in their liver. And most people don't even know it. Most feel completely fine even, and many won't discover it until routine blood work or an ultrasound happen to reveal it. But that might be too late. The reason I care about fatty liver disease isn't because it's simply a liver problem. In many cases, it's one of the earliest signs of metabolic dysfunction. It's often telling us that insulin resistance is developing, that visceral fat is accumulating, that the body is moving towards diabetes, cardiovascular disease, and metabolic syndrome. In other words, the liver often shows us where the future is heading. But the good news is that all of this is reversible. Fatty liver disease is often very reversible. And the earlier you recognize the signs, the easier it is to change that trajectory. So today I want to talk to you about 7 signs your liver may be struggling and explain why these signs are often telling you much more about your overall health than your liver alone does. Before we get into these signs, it helps to understand what the liver actually does, because most people dramatically underestimate how important this organ is. I'm going to take the time to explain it. Your liver is essentially the metabolic command center of your body. Every drop of blood leaving your intestine passes through the liver before entering the rest of your circulation. It helps regulate blood sugar, it helps store energy, it helps process fats, it produces bile to help digest food, it even manufactures protein and clotting factors. It breaks down medications, it detoxifies waste products, and it even performs hundreds of biochemical functions every single day without you ever thinking about it. And that's a lot of work. So when fat begins accumulating inside liver cells, things don't suddenly fail overnight. Instead, multiple systems begin functioning less efficiently. The changes are subtle at first, but they're often measurable, but not always. And they're often noticeable if you know what to look for. Sign number 1 is fatigue that doesn't make sense. Now, before you immediately dismiss fatigue because it can be caused by almost anything, I want you to really focus on this right now. I'm talking about a very specific type of fatigue. Not the tiredness you feel after a long day, not the soreness you feel after a workout. What I'm talking about is the feeling that you're operating at 60% capacity most days. You slept, nothing particularly feels stressful, yet you still feel drained. And one reason is that your liver plays a major role in regulating glucose and storing glycogen, your body's short-term energy reserve. So as fat accumulates inside the liver cells, insulin signaling becomes less effective, blood sugar regulation becomes less stable. Instead of stable energy throughout the day, you begin experiencing more peaks and crashes. At the same time, fatty liver disease is associated with low-grade inflammation. Your immune system is working harder in the background, and inflammation itself is metabolically expensive. What happens is that many people describe feeling exhausted without really an obvious explanation. They don't feel sick particularly, they don't feel acutely ill, they're just not functioning at the level they're used to. And that's often one of the earliest clues that something deeper is going on. Sign number 2, your waistline keeps expanding. This is where the liver story becomes a metabolic health story, because the most important fat isn't the fat under your skin, it's the fat around your organs. That is called visceral fat. And visceral fat and liver fat have a very close relationship. As visceral fat accumulates, fatty acids are constantly delivered directly to the liver, and over time that promotes liver fat accumulation. This is one reason why waist circumference is often a better predictor of metabolic health than body weight alone. And this is why you should stop obsessing about the scale. I've seen patients with completely normal BMI who already have significant fatty liver disease. The weight looked fine on paper. They looked healthy, but their metabolic health did not. That's why I pay much closer attention to waist circumference and waist to height ratio than the number on the scale. A simple rule to follow is that your waist circumference should ideally be less than half your height. For example, if you're 180 centimeters tall, your waist should ideally be below 90 centimeters. If you're 170 centimeters tall, it should be below 85 centimeters. These aren't arbitrary numbers. They're actually based on where visceral fat begins significantly increasing cardiometabolic risk. Your expanding waistline may be telling you a much bigger story than you think. Sign number 3 is mildly elevated liver enzymes. Many people discover fatty liver disease. They get routine blood work, but yet they don't have symptoms, no complaints, just a slightly elevated liver enzyme. The ALT or AST is elevated. And because the elevations are often mild, they frequently get ignored, sometimes by patients, sometimes by doctors, but mild elevations can be important. ALT lives inside liver cells. When those cells become stressed or injured, ALT leaks into the bloodstream. One mildly abnormal lab doesn't necessarily mean anything serious. I'm not saying that. But what happens is that persistent elevations deserve attention because they may be the earliest biochemical sign that fat is accumulating inside the liver. So if you've been told your liver enzymes are a little high, don't panic, but don't ignore it either. Instead, ask why. Ask whether it should be repeated. Ask whether there should be additional evaluations needed, because earlier intervention is where you get the greatest return. Sign number 4, you get pressure or discomfort under your right rib cage. This one is much less common than the others, but I still see it. Patients often describe it as feeling a pressure, they feel fullness, they feel like a dual ache, or just feeling like something isn't quite right underneath their right ribs. The liver sits in the right upper abdomen underneath the rib cage. So as fat accumulates, the liver can enlarge. When that happens, it stretches the capsule surrounding the liver, and that capsule contains pain receptors. The discomfort is usually not severe at all. It's not dramatic enough where they need to go to the hospital, not dramatic pain like appendicitis or a kidney stone. It's just vague. It's just so easy to dismiss, and it's easy to attribute it to other causes like indigestion or bloating. But when it persists and occurs alongside some of the other signs we've discussed, it's worth paying attention to. Sign number 5, worsening blood sugar. This is one of the most important signs on the list because fatty liver disease and insulin resistance are deeply connected. Your liver acts like a glucose buffer. So after meals, it stores glucose. Between meals, it releases glucose back into circulation. And it's a system that just works. But when the liver cells become overloaded with fat, they stop responding normally to insulin. The liver starts releasing glucose when it shouldn't. Blood sugar begins creeping higher and higher. Your insulin levels rise. And the cycle keeps repeating itself and eventually accelerates. You may notice that your fasting glucose start increasing. Your hemoglobin A1C is rising. You're becoming pre-diabetic or even diabetic at that point. Your triglycerides are just climbing up. You may feel sleepy after meals. You may notice stronger sugar cravings. Many people actually think that diabetes begins in the pancreas, but in reality, the liver is often involved much earlier than people realize. Sign number 6 is changes in appetite. This one surprises a lot of people. Sometimes patients tell me they feel much fuller, much faster than they used to. Others say they no longer feel hungry in the morning. Some simply feel that their appetite has changed without really knowing exactly how or why. Part of this reason may be related to inflammation affecting hormones that are involved in hunger and satiety. Part of it may also be related to an enlarged liver physically occupying more space, but the change is often subtle, not dramatic at all. And when patients look back, they realize the relationship with food shifted over time. It wasn't something that happened dramatically. It changed with time. Again, none of these signs by themselves diagnose fatty liver disease, but when several occur together, they begin forming a pattern that I think you should really look into. Sign number 7, fatty meals leave you feeling miserable. The liver produces bile. Bile helps digest dietary fat. And when the liver function becomes impaired, fat digestion becomes less efficient. And what happens is that people notice they feel worse after meals, especially fatty meals. They feel bloated, they feel heavy, they feel nauseated. They describe feeling off for several hours afterwards. Most assume it's simply just them getting older, or they have IBS or food sensitivity. And sometimes that is true, but sometimes it's another clue that the liver and metabolic system are actually struggling. And when those symptoms appear alongside elevated liver enzymes, increasing waist circumference, worsening blood sugar, fatigue, the bigger picture becomes much harder to ignore. So at the end of the day, with all that being said, what should you do? The purpose of this video isn't to convince you that you have fatty liver disease. It's to help you recognize potential warning signs. If several of these warning signs resonate with you, start with the basics. Know your waist circumference, know your blood pressure, know your fasting glucose, know your hemoglobin A1C, know your lipid panel, know your liver enzymes, because what gets measured gets managed. And if you haven't had labs in years, this might be a sign for you to have that conversation with your doctor. The goal isn't to chase disease. The goal is to identify risk early enough to change the outcome. And here's the part that gives me hope. Unlike many chronic diseases, early fatty liver is often remarkably reversible. And the great thing is that research consistently shows that losing just 5 to 10% of body weight can significantly reduce liver fat, sometimes even dramatically. The interventions that I'm about to tell you are not glamorous. They're the same things I talk about time and time again, but they work. Reduce ultra-processed foods, increase protein, increase fiber, walk more, strength train, do resistance training, sleep better, reduce excess alcohol, lose visceral fat, get in a low-calorie deficit diet. This will all improve insulin sensitivity, improve metabolic health. It's important to understand that the liver is quietly giving you information. The question is whether you're actually listening and acting early enough to make changes that will make a dramatic difference in your life.